Hi everyone, my name is Terry Scraggins, pronouns he, they, and this is the case study application, group 4, and mine was Rosa and Davis. So I'm not going to read it all just because I think that the people responding have also read it, but I'll go through each question. Um, The first question is talking about thinking of function and roles of social worker counseling and looking at the issue through the lens of a strengths based perspective and the values of social work. What would my priority be in working with Rosa? So, in knowing that Rosa is a 17-year-old female and she is a junior in high school, has hopes to become an airline pilot one day, began dating an individual named Davis. They're in love. They're having unprotected sex. Initially, they had protected sex and used condoms, but Davis he stated or articulated that he doesn't like using them. She insisted at first, and now she has not the last few times that they have had intercourse, but she doesn't want to become pregnant. So, in the first question of like what my priority would be, honestly, I don't know that unless there was some sort of referral that she was referred to me for, I don't know that I would have a priority. And I think about that in through the lens of like dignity and worth of the person and service, addressing social problems, but also self determination is like the first thing I think about. So in my mind, I would want to have a discussion with her and see where Rosa currently sits, if she has any preferences, if she has any wants or needs and what she wants. And then I would frame kind of the interventions or um, the interventions or like the modalities or working through this based on what she wants, because I would want it to be client centered. So when I look at like a strengths based perspective though, and the values of social work, I think about that just based on what she told me from our initial interaction, it sounds like she has pretty open communication with her boyfriend. Um, they discussed both of their sexual partners and how many they've had. I think that's a strength in the relationship. I think that her ability to be vulnerable with me and her best friend, I think that's something I would point out and highlight. It seems like Rosa is pretty self aware and has self determination. She knows that she doesn't want to get pregnant. Um, she has essentially like been passive from what it seems like. I would want to continue to explore like, did she consent without a condom, or did she not consent? And that might be something that needs to be explored further. And then, yeah, I think that priorities would just be around education if it seems appropriate, because based on social justice and um, being a voice and advocating for those marginalized and underrepresented populations, I think that that's important. Knowing what I know about like women and the history of America, and women and the disenfranchisement, I would want to make sure to address that and just kind of meet Rosa where she's at, because I don't want to. In the code of ethics, it talks about the least amount of harm or doing no harm, and I wouldn't want to come in with my own agenda, and I think that's extremely important to think about in this case study. Question 2, what would I do if my priority and Rosa's priority differs? I don't think that it would differ because of the approach that I would be taking from the beginning, engaging her and asking open-ended questions, asking her what she wants, asking her what she knows about sexual intercourse and like the science and risk factors that could potentially be associated with unprotected sex. But I want to do that in a way that is not accusatory or promoting or feeding into any stigmas. Just educational in a conversation as best as I could. And I think through building rapport with Rosa, I think that that's doable. But if, let's say we get to the point and she like hypothetically were to like ask me what I think, I would say that the importance is talking about consent and talking about like making sure that she's aware of like the consequences, because consequences can be good or bad, right? But I think that just making sure that Rosa's aware of like what could be the outcomes, potentially STIs, if Davis is unfaithful or if he hasn't been tested recently. I would want to make sure, and this is all like with Rosa's consent and like self-determination, because I wouldn't want to impose my like beliefs or values on her. But I also have an ethical and like moral obligation to make sure that she's educated on like what could happen. So as well, like she mentions that she doesn't want to become pregnant. So what are some potential other ways that we could ensure that that's not what is going to happen? And then also, if it's appropriate, like exploring what would be the outcome if she chose or they chose to not use condoms and she were to become pregnant. But this is all like at discretion. Question 3, what roles might a social worker or counselor hold in their work with Rosa? To me, that's pretty self-explanatory. I just think about like maybe doing some motivational interviewing with her to discuss like what does she want to change in the relationship, if anything. Also, I think potentially administering or like providing therapy if I'm licensed and that's what she's there for, if she gets referred to me. And then also resources, if she wanted to explore like resources for contraception, or if she were to become pregnant and she didn't want to child rear, like what are some alternative solutions? And I've said this like 5 million times, but I'm gonna say it again. In the context that Rosa is willing and like that is her choice. I would never want to come into a situation where I'm meeting with a client for the first time or for the 5th time and come into it with my own agenda, because that's not what I'm there to do. I'm there to support her where she is, and I'm there to assist her in problem solving and working through this challenging situation that she's experiencing. And then question 4, I think I kind of already have answered this. How might I address the difference between Rosa and Davis regarding condom use, if at all? I think that goes back to the educational piece. I think that goes back to like the competence piece and the social justice piece. I know that, and service, like for me, my job as a social worker is to help and address social problems. My job as a social worker is to help and advocate for those who are like more vulnerable. It's my job to respect the dignity and worth of Rosa. And so I think that if it comes up, which it sounds like it's gonna come up regardless based on the case scenario, I would just want to address and like further engage Rosa and see like where she's at. It sounds like they were using condoms and then they weren't anymore because Davis mentioned that he didn't like the feeling of it. But I think that to me, the biggest, like the most important piece out of this whole like vignette or case study is consent. Is she consenting to this? It sounds like she's already kind of uncomfortable, but she may or may not be consenting. And so that might be a conversation that we have to have. And then also going back to the educational piece, as I mentioned before, where is she educated and does she know about like what the consequences, good or bad, could be that could come from this? So that's my answer to the questions. I hope that it was helpful and solid. So, thank you.